Today's lecture covers the joints of the body. We will study various types of joints and their functions as well as diseases of the joints. Joints are classified by structure and function. A joint is the point where two bones connect. Under the structure classification, there are fibrous, cartilaginous, and synovial joints. Fibrous joints are bound by fibrous material. Cartilaginous joints are bound by cartilage, and synovial joints have a joint cavity. When we classify according to function, there are synarthroses, amphiarthroses, and diarthroses. Synarthroses are immovable joints. Amphiarthroses are slightly movable joints, and diarthroses are freely movable joints. Let's spend a little bit of time looking at the functional types of joints. Again, the three main types of joints are synarthroses, amphiarthroses, and diarthroses. Synarthroses are immovable joints, and we're talking about bones like the bones of the skull. Where the bones of the skull come together are known as sutures. Amphiarthroses are slightly movable joints. An example of this is the vertebrae of the spine. And diarthroses are freely movable joints, also known as synovial joints because they contain synovial fluid for smooth movement. An example of this is the knee and shoulder joint. There are 6 types of diarthroses or freely movable joints. They are the ball and socket, which permits movement in all directions. The shoulder and hip are examples. Hinge joints are like a door. They open and close in one direction, and that would be the elbow and the knee joint. Condyloid allows movement but no rotation, and that's your finger and jaw. A pivot joint is a bone that can swivel in a ring around another bone. Joints between the ulna and radius are an example of this. Gliding joints have limited movement characterized by smooth surfaces that can slip over one another. An example of this is the wrist joint. And a saddle does not allow rotation, only movement back and forth or side to side. This is the joint at the base of the thumb. The knee joint is a diarthrosis, a hinge, and a synovial joint. If you're unsure, go back and look at the previous slides. The knee joint permits both flexion and extension of the lower leg relative to the thigh. So knee flexion is the movement that decreases the angle between the two body parts, and the knee is bent. Knee extension is the movement that increases the angle between the two body parts, and the leg is straight. This diagram shows you both flexion and extension of the arm and the leg. The knee joint is the largest joint in the body. It is also a common site of injury. About 50% of all pro football players will be injured during their career. The most dangerous blows are lateral blows to an extended knee. For these reasons, we're going to study the knee joint in detail. You will be expected to know the ligaments associated with the knee joint as well as a few other structures. Be sure you know the labeled structures of the knee joint located on the following slides. The reason the knee joint is the most susceptible joint to sports injury is because it bears most of the weight of the body and the articular surfaces are not well fitted. This means that the bones sit on top of one another but are not snugly fit. The femur is not tightly fitted to the tibia and fibula. The knee joint has both extracapsular and intracapsular ligaments. It allows extension, flexion, and rotation. The patellar ligament runs from the patella to the tibia, and it is the ligament that physicians tap to test the knee-jerk reflex. This is tested by tapping just below the bent knee on the patellar tendon, as indicated by the arrow. Normally this causes the quadriceps muscle, which are the 4 muscles located on the anterior side of the femur, to contract and bring the lower leg forward. It has given rise to the saying, a knee-jerk reaction. It is also called the patellar reflex. You can click on or type this URL into your browser and see the actual patellar reflex. I mentioned already that the knee joint contains a capsule. The knee joint capsule is the structure surrounding the knee made up of ligaments, bone, and fluid-filled cavities. The knee joint has both extra and intracapsular ligaments. A ligament connects 2 bones. Take a look at this diagram as I describe the extracapsular ligaments. The extracapsular ligaments lie outside the capsule of the knee, that's why they're called extracapsular, and they prevent the hyperextension or overextension of the knee. The extracapsular ligaments are the lateral collateral ligament, or LCL, and medial collateral ligament, MCL. You can see both of these on this diagram. While extracapsular ligaments lie outside the capsule, intracapsular ligaments lie inside the capsule of the knee and help stabilize the knee. They include the anterior cruciate ligament, the ACL, the posterior cruciate ligament, the PCL. It's the larger and stronger of the two. Because these two ligaments cross each other, they are referred to as cruciate ligaments, which means cross. You can see that in this diagram. Take a look at this diagram and note where the anterior cruciate ligament, the ACL, and the posterior cruciate ligament, the PCL, cross. See if you can identify the parts of the knee. The answers are on the following slide. Here are the answers. I hope you did well. If not, you may want to go back and review. This is a posterior view of the knee. See if you can again label these parts. Here are the answers. I hope you did well, but if not, please go back and review. We're going to talk about some disorders common to joints. They include sprains, dislocations, bursitis, tendinitis, arthritis, and gout. You'll notice that several of these words end in itis. The ending itis means inflammation of something. Remember that ligaments reinforce a joint because they connect one bone to another bone. If these ligaments are stretched or torn, this is known as a sprain. Common sites of sprains are the lumbar region of the spine, the ankle, and the knee. If you have a partial tear in a ligament, it will repair itself, but repair is very slow because ligaments are poorly vascularized. If you have a ruptured ligament that's torn all the way across, it will require surgery, unlike a partial tear. The treatment for sprains is RICE. This is an acronym and stands for Rest, Ice, Compress, and Elevate. For decades, RICE has been the gold standard for orthopedic injuries like minor sprains and strains. Even fractures are subjected to RICE treatment until they can be surgically repaired or permanently immobilized, usually with a plaster cast. Dislocation occurs when bones are forced out of their normal position in a joint cavity. It is a common contact sports injury. The treatment for dislocation is reduce or reduction. This means to return the bones back to their normal position in the joint cavity. This should only be done by a doctor and not by your best friend. Here you see the endings itis, as in bursitis and tendinitis. This means inflammation of bursa or tendons. Bursa are the fluid-filled sacs or sac-like cavities, especially one reducing friction at a joint. Both are usually due to overuse or misuse of a joint. Symptoms include pain, redness, and swelling. Here are the 5 cardinal signs of inflammation: heat, redness, swelling, pain, and loss of function. Treatments for bursitis and tendinitis include the NSAIDs like ibuprofen, also known as Motrin. NSAID stands for non-steroidal anti-inflammatory drugs. Both can also be treated with aspirin. The normal course of treatment is 12 to 15 days. Side effects of both drugs are gastric upset. They should be taken with food, usually the largest meal, to prevent gastric upset. Arthro refers to the joint and itis refers to inflammation. So arthritis is inflammation or degeneration of a joint. There are more than 100 types of arthritis, and it affects about 1 in 7 in the United States. Arthritis can be very crippling. Symptoms are pain, stiffness, and swelling. 2 types of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis, also known as OA, is the most common type of arthritis. It is non-inflammatory in nature. It is degenerative, which means it results from wear and tear. It's most prevalent among the elderly. The cause is ischemia or lack of blood flow. It affects articular cartilages, which are the cartilages that cover the ends of the bones. Crepitus is associated with OA. It is that crunching noise that occurs with movement. OA is slow, but it is irreversible. There is no cure for osteoarthritis, but the treatment is moderate exercise to help improve blood flow and to prevent stiffness, and Tylenol for pain. Rheumatoid arthritis, or RA, is a chronic disease and it is inflammatory in nature. The onset occurs between 30 and 40 years of age, and females are more affected than males. The primary joints affected by rheumatoid arthritis are the fingers, wrists, and ankles. Here are some things we do know about rheumatoid arthritis. It is an autoimmune disease. Auto means self, and in these individuals, their immune system is attacking their body. Strep and viruses might trigger this, we're not sure. Stress and genetic factors may also play a role. Like many diseases, rheumatoid arthritis can be treated with aspirin or NSAIDs. An unusual treatment for rheumatoid arthritis is gold. We don't know why it is effective, but it does seem to work. Also, alternating heat and cold. Again, we don't know why. Sometimes these individuals will require chemotherapy like cytotoxin or methotrexate, and antimalarials seem to help. And an example of a typical antimalarial is Plaquenil. Gout is something that most often affects a single joint, and usually that joint is the large toe. This disease is more common in males and it runs in families. Sometimes bones will fuse together and the joint becomes immovable. Uric acid is deposited in soft tissues of the joint, and that's the problem. Uric acid is a waste product. Gout is usually treated with a drug called colchicine. Colchicine works by decreasing swelling and lessening the buildup of uric acid crystals that cause pain in the affected joint. NSAIDs are also effective in treating gout. It is important to rest the joint, to lose weight, and to use cold packs. There are certain foods that are high in purines, and purines can lead to the production of uric acid. So people who are predisposed to gout want to avoid these. They include liver, kidney, turkey, and ham. There's a drug known as probenecid that's used for the prevention of gout. It promotes the excretion of uric acid, which is the substance that tends to accumulate in the joint.